There's a bona fide gold rush going on with virtual reality, and nearly every company seen at last year's Consumer Electronics Show had some take on VR or its sibling, augmented reality. However, this is not the first time VR had this much hype. Back in the 90s, the hype surrounding this technology had an adverse effect and led to a decrease in its popularity. Today, researchers, technologists, and anyone else working in the field of virtual reality is all too aware of the dangers of hype and as a result have tended to downplay its capabilities. They often avoid the term virtual reality in preference to virtual environment, which has a less negative connotation. When it comes to emerging technologies, numerous tech companies are eyeing virtual reality as a new world ripe for plunder. The technology itself, of course, has existed for decades in one form or another. In fact, the first examples of VR were for artistic purposes with the use of 360-degree murals, which enabled the observer to engage with the artwork on a simple level. VR has since evolved into the digital age. Companies like Samsung, Sony, Google, and Oculus are now all names associated with VR for gaming, social, and mobile platforms. Microsoft has its own offering, evening the playing field with the HoloLens, which focuses on augmented reality or holograms. Both experiential technologies have many utilizing features that can prove beneficial to different operations if successfully incorporated into their framework. Both augmented reality and virtual reality have the remarkable ability to change the very perception of the world around us, but they differ in the perception of our presence. So what is the difference between augmented reality and virtual reality? Augmented reality, or AR, is a live direct or indirect view or a physical, real-world environment whose elements are augmented or supplemented by computer-generated sensory inputs such as sound, video, graphics, or GPS data. Most people are familiar with the mobile app Pokemon Go, which uses augmented reality by placing creatures in real-world environments. Players could use their smartphones to catch the game's monsters scattered throughout the world and compete with other players. Thanks to its success, it will almost certainly influence the design of future AR experiences for years to come. But what if instead real people were immersed inside Pokemon's fictional digital world? Or better yet, gave healthcare professionals the opportunity to sharpen their assessment and decision-making skills without risks to patients in realistic, challenging, immersive environments. This is the idea behind virtual reality. Technologies like AR and VR are being used by technological innovators in university-simulated clinical skills laboratories to support medical students' technical competencies as they graduate into a digital healthcare environment. These technologies provide a safe innovation environment for healthcare solution developers to experiment with implementing technology to improve healthcare practice and faculty development. With the entry of consumer-grade VR goggles like HoloLens, HTC Vive, Samsung Gear, and even Google Cardboard, VR has hit a new wave of adoption and healthcare is starting to realize the opportunity VR offers in patient care. The immersive experience that VR offers can provide learners a real opportunity to learn by doing, thereby increasing motivation and retention. It also provides a huge confidence boost to the learner who is able to master skills in a virtual arena before applying these skills in real-world context. Immersive learning environments also allow learning from failures and encourage out-of-the-box thinking. When it comes to healthcare, research has already showed that learners can accept AR as a learning technology, and that AR can improve the learning effect by acquisition of skills and knowledge, understanding of spatial relationships and medical concepts, enhancing learning retention and performance on cognitive, psychomotor tasks, and simulating authentic experiences. Augmented reality and virtual reality are widely predicted to be two of the technologies which help shape the coming decades. But while most of the attention will inevitably be on consumer products, and how quickly it takes AR and VR to go mainstream in our homes, both technologies are already having a significant impact on healthcare worldwide. According to research by Goldman Sachs, the global market for AR and VR healthcare technologies will be worth $5.1 billion by 2025, second only to the AR and VR video game market. So why are healthcare industries so excited by AR and VR? What are the differences between them and where are they best deployed to drive improvements in public health? Healthcare is one of the biggest adopters of virtual reality commonly used for surgery simulation, phobia treatment, robotic surgery, and skills training. One of the advantages of this technology is that it allows healthcare professionals to learn new skills as well as refreshing existing new ones in a safe environment. Plus, it allows this without causing any danger to the patients. The immersive qualities of VR make it a very good simulator, so it's excellent for test driving medical procedures. In surgery, for example, VR can be used to provide practitioners with incredibly high-definition 3D illustrations of specific organs or body parts, allowing them to walk through or plan a procedure. This also has obvious benefits for surgical training. While virtual reality has positive potential in helping practitioners preview and plan, there are apps like Proximie used in real time to support procedures as they happen. A surgeon who requires advice from a specialist on a certain procedure can use a tablet to live stream what they are doing to a consultant at some remote location. So where is this technology going, and what is needed to get there? For VR to be truly immersive, it must engage sensory organs, including the use of haptic suits to create sensory engagement in the body, vibrations to emulate bumping into walls or getting hit by something, contraptions to emulate motion, wind on the face as if you're flying. Ideally, there will be layers of sensory immersion added beyond eyes and ears. The growing integration of technology and digitalization in healthcare, increasing health expenditure and focus on delivery of efficient health services, and its significance in training healthcare professionals are some of the key factors driving the increasing adoption of AR and VR technologies. The AR and VR market is exploding with investment and set to grow exponentially, potentially changing our world. But as with many technologies, the enthusiasm to embrace the new could mean we are not looking before we leap. And while the benefits are clear, there is little to no research around potential side effects of long exposure to VR. Maybe we should wait a while before giving up on reality.